Back pain's a mystery, brother. Well, I'm in a pain class.
Not, I
80,
just solved it.
85% of low back pain is non-specific, meaning there's not a source, like a mechanical source. There's so many aspects to pain. That this pain class is really interesting. But
I think a general thing is people either both don't load the spine or bend the spine in different ways. Like I feel like that's
it's
completely
bend.
avoided.
I think it's bend. I think we load it a lot. Anytime you pick something up or bend over to grab something or do your socks, I think you're like,
But how much load is that compared to like
I don't know if
I
we
guess like
need
Jefferson
something more
curl?
loaded. I don't think we need, gravity's already working on us all the time. I feel like it's always being loaded. I feel like it's always like, you never hear of like too much space in somebody's low back. It's like things are too compacted. I feel like it's always because of too much of that, which is like load.
But that's one kind of load.
I feel like we need to learn how to bend and
Yeah,
activate
I think
muscles.
we're
down
agreeing.
there.
So I think doing more side bend, doing more rotational,
back bending,
flexion,
creating
and extension.
space, extension. I think back extension is the missing
Absolutely.
one. I feel like
Well, everyone's doing sit-ups and
everything's forward.
or like even like loading a deadlift or something. But
Yeah.
do more extension.
Extension. I agree. Extension with a little tilt, extension with a little tilt that way.
I'm just saying it's more complicated than if we're talking like legit.
Name one adult that is doing anything back extension though.
But I would argue it's
Name
more
one.
chronic posturing than anything. Like,
Okay,
yeah,
I
we're
agree.
like
I agree.
we're training in flexion and then we're sitting in flexion for
Literally.
however many hours
sure.
a day. Like,
So how are we supposed to get extended?
yeah, so I would work on chronic posture before
How do you
just
work
doing
on
max
chronic
back
posture?
extensions. What?
How would you work on chronic posture?
Putting something below your low back or having a better just like seat in general, just so your spine is in neutral and you're not compressing the anterior portion of your discs. Because if we're talking like disc injuries, or I don't know what low back injury we're talking about specifically, but there's just a lot of different
Anything back.
Anything low
mechanisms. There's 85% of low back injuries there's no source. It could be psychological. There's a lot of things that low back be.
That's where you should spend the rest of your life then. If 85% of people
It's
that
true.
have low back don't know what it is, then we should figure out what it is.
But that's what pain is. Pain, there's biopsychosocial, spiritual aspects of pain. Like pain is super complex. Like chronic pain affects so many more people than you would think, and there's no source. There's no true physical damage that is causing their pain. It's just like either peripheral sensitization or central desensitization, where their brain is literally telling them that there's a noxious or painful stimuli and there's nothing there. So you could have pain to putting on a sock and there's no pain stimulus, but you're having pain. Like the brain is complex and we don't like understand even
That's valid.
the portions of pain, but it's complex.
I'm just saying a major piece of that is you said 85% of back pain or whatever. 99% of people are not moving their spine. And so when they do get into that position, their brain
the muscles
isn't
aren't working.
accustomed to that.
But that
and
movement
the muscles
is not,
have to work because of the brain. Because the nervous system needs to tell the muscles to fire.
but I'm just saying that movement's not necessarily healing an injury. That movement is telling the brain that, oh, this movement is not painful. Like I can do this movement because it's not truly something that's causing me physical injury. Like the movement is not necessarily healing a muscle or healing a joint or healing a disc. Yes, it's helping like blood flow, but I feel like more of it is the mind saying, I can access this range and it doesn't hurt. I can repeatedly do this because it's not truly causing me physical injury. The definition of pain is either physical or emotional. It's not just physical injury that's causing pain.
What
You're speaking more to the people. You're speaking more to the people who are already in pain. I'm saying a way to a less likely way to get there is to just continue moving as long as you can through life.
What percentage of people from age 25 to age 90 are doing any sort of an activated back extension? Truly. What percentage of people? No, just I know, understand you don't know the answer, but give me what percentage you think that is? It's like actually going to lay on the ground and do some sort of a back extension or put their feet in a machine, whatever, the Russian curl machine, right? And do some sort of a back extension. Is lay on the ground literally and just extend your back. What percentage of adults are actually doing that?
Probably not that much, but there's also probably not that much that are doing the opposite either. We just don't exercise that much in general.
Right.
Definitely more of that, though. It's a lot more natural part of life to be in flexion or to train the abs rather than the back.
Yeah.
You know?
And so that percentage is low. Then how much lower is the back extension population? I'm just saying, but low back pain is like a very serious, common thing. I know Paige's uncle, the grandpa, like grandparents, like getting different shots, right? Or trying all these different things because their back hurts all the time. They have to walk with a cane. I feel like that's certainly a very big issue I'm just going to talk about the United States. I'm just saying that's probably a huge, massive issue in the United States is low back pain and chronic posture. I think that's one of the most important things that we could help anybody with.
It's the number one thing PT sees, low back pain. But
I didn't even know that stat. This is coming from just my unprofessional opinion.
But I'm saying over a majority is not due to actual physical injury. Like, it's complicated. Like, whether it's referred pain or whether it's... Because, like, even if you took an MRI of all of our spines, there'd be degeneration and it wouldn't look that pretty. But people are walking around and they're fine. Like, you can walk around with degeneration in your spine and not have pain. There's crazy x-rays.
80.
But there's crazy x-rays of... You look at it and it's, oh, that guy definitely has osteoarthritis, and they're walking around pain-free. Like,
yeah,
it's valid. The image or what is going on anatomically doesn't always paint the picture of what they're feeling, and
I understand.
It's important to understand.
I understand what you're saying.
There is a lot of psychological and social aspects of pain, because like increases in anxiety, depression, medications, all that stuff is increasing your risk of pain, of chronic pain, of any sort of pain. So it's like,
no doubt about that. No doubt.
It's complex.
Chicken or the egg?
Oh, that's for sure. Very complex. But move your spine more, people. Do some side bends. Do some Supermans.
Feel